everybody. I'm Chini Paluro, family physician, Senior Director for Professional Relations and Clinical Operations at Walmart Health here at Walmart. We're here today with Walmart Wellness Live, and we have a few very special guests. First, we have psychiatrist and mental health expert, Dr. Christine Crawford. Additionally, we have Walmart pharmacist Kevin. Thank you for being here with us today, everyone.
Hi, Chinny. Thank you so much for having me. You know that mental health is very close to my heart, and I'm so glad that Walmart is focusing on helping people expand their understanding of such an incredibly important topic.
Hi, everyone. You're right now, because with social distancing from COVID-19, mental health education is now vital more than ever.
You know, that's so true, Kevin. With this COVID-19 pandemic, it's really having a tremendous impact on people's mental health all over the country as well as all over the world. You know, rates of depression and anxiety have tripled since the pandemic has started. And a lot of that has to do with the fact that people are experiencing a tremendous sense of loss. They're losing their sense of normalcy, as well as they've lost loved ones due to this pandemic. You know, feelings of uncertainty, helplessness, and uncertainty certainly make symptoms of depression and anxiety worse. And we can't forget about the social isolation and how that has negatively impacted people.
You're right. I was just having that conversation with my mom because we were having a hard time not being able to see each other. So Dr. Crawford, tell me, what can people do right now just to maintain health during just COVID-19? What can we do?
You know, that's a really excellent question, and it's an answer that we all need to hear the answer to. I think there are several things that people can do to reduce the impact that COVID has on mental health. One thing that people can do is limit the amount of time that they spend consuming information about the pandemic. We're just constantly surrounded by news reports, social media reports, and sometimes that can increase anxiety and make people feel quite overwhelmed. So I recommend that people limit their use of some of that information to just 15 minutes at a time so that you don't get more stressed out. You know, the other thing that people could do is try to remain as connected to other people as much as possible. With social distancing practices, it's been so difficult to do it, but calling out a friend or family member can really make a world of a difference. And sticking to routines as well. You know, COVID has been so disruptive, and not only to children who aren't able to go to school, but adults and our work-life balance. So as much as you're able to maintain some sense of structure and routine, it will give you a better sense of control during a really uncertain time.
Well, I appreciate that. Even my family, we've done a couple of Zoom sessions where we come together just so we can try to be connected. But I'm going to be honest, you know, just working in the pharmacy here at Walmart, I've seen tons of just anxiety even before the pandemic even happened, meaning that just you see a lot of medication comes through for that anxiety and depression. So with that, before the pandemic, can you talk a little bit more about just anxiety and what was happening even before this happened?
Yeah, of course. I think it's important for people to realize that anxiety and depression are very common conditions within our country. In fact, 1 out of every 5 adults has experienced an anxiety disorder within the past year. We actually know that rates of anxiety are higher among females, and we see that both in adults and adolescents. The other important condition that's important to talk about is depression. You know, Kevin, 17 million adults have experienced a major depressive episode within the past year. And so we know that when anxiety and depression go untreated, it not only has negative consequences for that individual, but it can have tremendous consequences on the relationships that they have with other people, with their family and their friends.
I appreciate that. Can you talk a little bit more about anxiety and kind of like what it's really like to experience it?
Yeah, so anxiety is kind of like, Kevin, have you ever been in a situation in which you're driving a car and you almost hit another car, or you're rushing to a store before it closes, and just this intense feeling of concern and worry that overcomes you and results in the release of all of these hormones that make your heart rate go up, that make you start breathing faster and shaking? Well, anxiety is like living under those conditions all of the time. So Kevin, you can imagine that's got to be quite difficult day in and day out to feel that way. Not only do you feel overwhelmed with fear and worry, but you can have some other symptoms like not sleeping well, having trouble with your concentration, as well as people can have headaches and some stomach problems as well. So anxiety can have a tremendous toll on your emotional well-being and your physical well-being.
I appreciate you telling me that. But sometimes it can be a little obscure. I remember a time in my life, I was working really, really hard on the job. I gained a lot of weight, not really taking care of the temple, so to speak. And I got to a point where I had some social anxiety. I didn't necessarily want to necessarily be with people, be seen. I'd only go to work. But when I had to do something like take pictures or be with a bunch of people, I could feel that angst coming up inside. And here's my question to you. Just as you're describing what you're saying, how do people really know that they're actually dealing with the anxiety? Because I didn't even know I should be reaching out.
Yeah, so the thing with anxiety is that it's actually an internal response to stress. It's that constant, persistent feeling of dread, impending doom. And the thing about anxiety is that it interferes with your day-to-day function. Kevin, people who have anxiety disorders, it's hard for them to work, it's hard for them to maintain relationships, and to do well in other areas of their life. Now, stress, on the other hand, is a normal thing that we all experience day to day. And stress is our response to an external situation that can make us feel a little bit tense and under pressure. But the difference between stress and anxiety is that when you are no longer in that situation that's making you feel stressed, you actually feel better. Unlike anxiety, the conditions could be totally fine and perfect, and you could still experience that impending doom and sense of feeling quite overwhelmed.
I get that, and I appreciate that information. So just tell us, for the lay person, we're stuck in our homes, we can't quite go anywhere. What can everyday people do right now in our everyday lives to actually deal with that?
Wonderful question, Kevin. You're asking all of the right questions. So when it comes to managing stress, the way I think about stress is pressure that's being applied on you in all sorts of direction, and it can have an impact on your physical as well as your emotional health. And so finding ways to take space so that you can decompress and relieve all of that stress and pressure is really important. So Kevin, there's a few things that people can do to relieve themselves of that pressure. One thing that I recommend is deep breathing exercises. Breathing in and out and allowing all of that oxygen to flow through your lungs and your brain is really helpful because it actually helps to reduce your heart rate, to reduce your blood pressure, and to slow down your breathing so that you're not feeling so physically overwhelmed. The other thing that's really helpful is meditation. And there's a tremendous amount of resources available online for different ways in which you could do meditation. So finding ways to take time for yourself to decompress is really important. And exercise. What an amazing thing to do to relieve yourself of all that pressure and stress. So I highly recommend those things.
I really appreciate that. And I just have to echo to anybody who's watching, if you're kind of like me or you have a busy job, you really want to learn how to just sometimes just breathe deep, because in the pharmacy world, it can be kind of hectic. So it's really important to sometimes just control the breathing so that you have an opportunity to literally become present so that you're okay, and no matter what's happening. So,
Absolutely, Kevin. One thing that I just want to add is that when it comes to anxiety, is that people can actually do those things. The meditation, the exercise, the deep breathing, and they still feel constantly overwhelmed with doom and with worry. And so if it ever gets to a point where you're constantly feeling that way and it's getting in the way of your day-to-day function, perhaps that's a time to actually go and seek out mental health treatment from a professional. But the problem is there's so much stigma that's associated with mental health conditions that it creates a tremendous barrier to people actually going out to get the care that they need.
I can hear you on that one. And so with that stigma, sometimes people could be a little ashamed or a little embarrassed, because for me, that was kind of my thing. Do you see that happening?
Yeah, so stigma is something that as a psychiatrist I come across time and time again. And it's not just stigma that's related to the mental health conditions, but also the treatment that people like myself, psychiatrists or therapists, provide to people with these conditions. You know, the thing about stigma is that it can make people feel ashamed. It can make people feel isolated because they are worried that by having this mental health condition is that it will create this new sense of identity, this new label on them, and will make it such that people no longer view them as individuals, but rather view them by the condition that they have. And the other concern is that a lot of people don't talk about seeking mental health treatment, so they're worried about what it would be like and what their friends and family may think about them if they actually go to see a psychiatrist or a therapist. So it can really get in the way, having these worries about how people perceive them having the mental health condition and worries that they have about getting the treatment that they need. And so I think it's so important for people to realize that getting treatment for mental health improves your overall emotional well-being, which at the end of the day will improve your overall physical health as well.
So you're saying that getting that treatment is very important. They probably should just reach out to get help if people feel like they need that. Is that what I hear you saying?
Absolutely. If you find as though, despite your best efforts to overcome stress, anxiety, and sadness, I think it's really important to talk to a doctor about it. Talking to your primary care doctor about what you're going through emotionally can be incredibly helpful. They can provide various resources for you if you're experiencing stress due to a number of situations like financial stress, stress within the home due to housing insecurity. They can connect you with social services. And if the primary care doctor thinks that your symptoms of depression, anxiety, or other mental health conditions would benefit from treatment, they can also lead you in the direction of a good mental health professional.
Thanks, Dr. Crawford. That's very helpful. Now, in your experience, are there any particular groups that are more prone to unique challenges that tend to reach out more than others?
Yeah, so it turns out that within the Black community, within Black populations, we know that Black people actually experience greater psychological distress whenever it comes to various mental health conditions. In fact, they experience 20% higher rates of severe mental illness. The other thing that makes it complicated is that they are less likely to utilize mental health services compared to a lot of other groups out there. And stigma has a lot to do with it because people do not feel comfortable going to get the treatment that they need, and they're worried about what other folks will think about that if they do get the treatment. There's also some distrust when it comes to the mental health field that Black people have when it comes to my field. And so those are multiple barriers in which we have to overcome in order to make it more likely that Black people get the help that they need. And the same thing that we see with our Hispanic population, that the rates of utilizing mental health services is less. And again, it has to do with stigma. So that's why I'm so happy to have opportunities like this with Walmart to talk about mental health so that people feel more open and willing to share what their emotional experiences have been.
Thank you for sharing all this information, Dr. Crawford, and thank you, Kevin. Those were great questions. Let's see what our customers are asking about how to maintain mental health. Our first question is, how do I know if I need to see a doctor for my anxiety? How do I know when it's too much and I should maybe seek help?
Such a great question, because I think a lot of people wait for quite some time before they're ready to talk to a professional about their issues. They feel as though they can just deal with it on their own. They feel like if they work hard, if they pray, if they just not think about the negative thoughts, that it will all go away. But the thing is, when you're constantly feeling anxious and constantly feeling like you're experiencing the fight or flight response whenever we experience really intense situations of danger and fear, but to have all those hormones and to feel that way day in and day out, it's unsustainable. You won't be able to work, you won't be able to take good care of your kids, and you won't be able to take good care of yourself. And so I think that if people start to realize that there are aspects of their lives that are difficult to manage and that are kind of falling apart, that is a clear sign that they do need to get some mental help. And so whether that's talking to your primary care doctor, talking to a friend, or even making the phone call to call someone like myself or a therapist is so important, because you do not have to live that way every single day. A lot of people don't realize that there is relief out there in the form of various treatment options. So it's just a matter of reaching out and finding the right fit when it comes to your anxiety treatment.
Thank you, Dr. Crawford. There's, even when you think about meditation and wanting to find help on your own, there's so much out there, and sometimes it's easy to get lost and not really know where to go. What would you suggest was a good resource for learning meditation to ease stress?
Jenny, that's a great question, because you're right. There's so much information out there about meditation. What's really neat in this day and age in 2020 is that there are a lot of technology-based programs that you can find on your computer. You can find it on your phone in the form of various apps that can do things like progressive muscle relaxation, guided imagery exercises. There's a whole bunch of different meditation exercises that people can do. In addition, there's also the internet that has a whole list of some practices that you can do. And there are podcasts in audio of things that you can listen to if you're trying to fall asleep, if you're driving in the car. And what's nice about meditation these days is that you don't always have to do it in a meditation studio. You could do it at home. You could do it while you're in the shower. You could do it while driving. It's just so accessible now to be able to access those resources. I think it's a really great thing for people to do. And if there's one meditation practice that doesn't work for you because your mind starts to wander and drift off, that's okay. Just find another technique and see if that's a better fit.
Thank you. So, I know a lot of people take medication for anxiety, and, how many people actually end up needing to take medication for anxiety? And, how do I know if it's right for me, if that's what my doctor recommended? And I think, pharmacists are such trusted resources in this environment, and people like Kevin, who we can go to and ask about it, will give us information on our medications and everything else that is involved. But from your perspective, Dr. Crawford, how do I know whether I should be taking medication?
Yeah, and I think that's a great question, because I think people often assume that if they have a mental health condition and they talk to a doctor about it, it automatically means that they're only going to receive one form of treatment, and that treatment will be medications. The reality is, when it comes to treatment for anxiety and depression, we like to use a combination of both medications and therapy, and having the two together, we know achieves the greatest benefit. And there have been numerous research studies to prove this fact. The thing about medications is that even though there is a decent number of people who have anxiety disorders, not everyone actually receives treatment by medication, because either they don't feel comfortable with the medication or it's not the right fit for them. And so I think the way to know whether or not taking a medicine is helpful is talking to a mental health professional, getting a sense as to how severe the symptoms are, and whether or not taking medicines will help to reduce the severity of your symptoms so that you're able to live your best life, live to your full potential, and not feel weighed down by the constant worry and sense of fear day to day.
Thank you for that. I know, Kevin, you probably deal with anxiety regarding medication use, all the time. So, going to our next question, are there things that I can do to prioritize my mental health? And to add to that, speaking to the stigma that you mentioned earlier, are there things that I can do to help lower the stigma of seeking help for my coworkers and my family, friends, everyone that I'm around? What can I do for both these things?
Yeah, Chinny, this is certainly something important to touch upon, having to do with the stigma, because I think that's one of the things that makes it difficult for people to prioritize their mental health, when we know that the majority of people in this country know that it's important to prioritize their mental health, but a small percentage actually do that, right? And so with stigma, folks feel as though they don't want to be associated with a particular condition. They feel as though they don't want to be associated with a group of people that has been misrepresented by the media and other sources. I feel as though there has not been accurate portrayals of what it's like to experience a mental health condition, because the reality is mental health is overall general health. And so it's so fascinating to me as a psychiatrist. I went to medical school. I have a medical degree, but it's like psychiatric mental health conditions are over here and medical conditions are over here. But what we need to do is find a way to bring the two together so that mental health conditions are viewed the same way that we view diabetes, high blood pressure, and heart problems. So I think the more that people are open and willing to share what it is that they're feeling inside, rather than covering it up, masking it up, and pretending that everything is okay. So being open and honest with your friends and family about what you're going through is really important, and to do the same when it comes to seeing your primary care doctor, so that you can be informed of mental health as well as the treatment that's available. But in terms of your question about how to prioritize mental health, we're so good at prioritizing certain things and not other things. In terms of getting our nails done, or setting up our hair appointment, or making sure we mow the lawn, there are certain things that we actually put in our schedule, set alarms for, to make sure that we actually do it because we set it as a priority. I think we need to do the same when it comes to mental health. Schedule a time each and every day just for yourself, whether that's to exercise, to meditate, or to connect with friends and family over Zoom. Whatever you need to do for your mental health, schedule it in, take time for it, and to do it every day. And to make sure that's protected time and that it isn't influenced by other demands that you have going on in your life.
Thank you. So important that we put the oxygen mask on ourselves first.
Absolutely.
Thank you for tuning in, everyone. And thank you, Dr. Crawford and Kevin. You gave us some great information about managing our mental health from home. Remember, you can use your local Walmart pharmacist as a resource, a very trusted resource. Right now, most Walmart pharmacies are open and providing prescriptions, screenings, and immunizations with easy pickup options available. We're also offering a special shopping hour for seniors on Tuesdays. Tuesday mornings, 1 hour before the store opens. And remember, if you're struggling with mental health and need immediate assistance, you can reach out to NAMI's helpline, which is 1-800-950-NAMI, or the National Suicide Hotline at 1-800-273-TALK or TALK. But always, if you are struggling and need help, you can call 911 for any immediate safety concerns. You're watching us from the Walmart Wellness Hub, so click around for more information. Thanks again for joining us. Stay healthy, make your mental health a priority, and stay safe. Thank you.